Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Federal government to sanction returning travelers from COVID-19 high-risk countries who flee quarantine. Poor performance in Unified Tertiary Matriculation Examination (UTME) in Jigawa State blamed on coronavirus pandemic as a result of closure of schools. And a hotel in Algiers converted into a hospital for coronavirus patients as case numbers continue to climb to record highs and overwhelm hospitals. Hello, good evening everyone and welcome to the program. Let's begin. The federal government will now prosecute people who abscond from quarantine facilities, as such individuals constitute a major risk to the country's health system. Well, speaking at a news conference in Abuja, the Minister of Health notes that reports from port health officials show that some passengers from high-risk countries continue to abscond from facilities where they are quarantined. Or the minister warns about the dangers posed by such individuals, insisting that the government will handle it with the desired severity. COVID-19 infections in Nigeria has been on the rise in the last 3 weeks, averaging 150 cases per day.
The prevention and control of COVID-19 is in everyone's hand.
In the past 24 hours, the world has witnessed an increase in reported cases of COVID-19 across a significant number of countries due to the high transmissibility of the Delta virus variant. It is disturbing that despite evidence of the emergence of a third wave of the COVID-19 pandemic, citizens continue to refuse in large numbers to adhere to public health advisories. The Federal Ministry of Health point of entry, the point of entry pillar of the COVID-19 response, has been continuously monitoring passenger arrivals, especially from high-risk countries like India, Turkey, and Brazil. And this process has been an arduous one, given that port health staff have continued to report a trend of abscondment of quarantined passengers, an act which can be detrimental to pandemic response and public health safety. I want to entreat all persons to comply with this our public health regulations and cooperate with the public health staff. Otherwise, there can be sanctions which can include prosecution.
And the maiden edition of the Nigerian Conference of Applied and Field Epidemiology, NICAFE, hosted by the Nigeria Center for Disease Control and CDC in collaboration with partners, continues on building back better COVID-19 and other diseases outbreaks. Today, the World Health Organization Country Director of Nigeria, Dr. Walter Kasadi Mulombo, says that on the African continent, the pandemic has exposed critical gaps in our health system abilities. He said that we need to review the lessons learned so far in order to inform public health responses. Meanwhile, the NCDC says that the Surveillance Outbreak Response Management and Analysis System, SORMAS, which was deployed in 18 states before the pandemic, has been useful in the digitization of the COVID-19 response. Let's now take a look at the virus outlook.
The prevention and control of COVID-19 is in everyone's hand, and that's the message of the Nigeria Center for Disease Control through its Take Responsibility campaign, as they're reminding Nigerians to ensure adherence to all non-pharmaceutical interventions. The NCDC is reporting 213 positive COVID-19 infections from 12 states in the last 24 hours, indicating a reduction by 3 from the cases recorded a day earlier. Again, Lagos reported the highest figure from the latest tally with 157 cases, followed by Rivers with 20 cases. 12 cases were reported in Plateau State. 6 cases were recorded in Enugu and Oyo State, while Gombe recorded 3 cases. Other states include Bauchi, Imo, Kaduna with 2 cases each, while Edo, Ekiti and Ogun reported 1 case each. According to the agency, 0 cases were reported from Nasarawa, Sokoto and Ondo states. Nigeria now has a total of 171,324 confirmed cases. 9 persons have been discharged in the last 24 hours, raising the total number of recoveries to 164,798. 2 persons were reported to have died from COVID-19 complications, increasing the fatality toll to 2,134. Presently, there are over 4,382 active cases in the country, while over 2.4 million samples have been tested so far. Over 6.5 million confirmed cases and more than 164,000 deaths have been recorded across countries in Africa. Globally, more than 194 million COVID-19 cases have been confirmed, while deaths have surpassed 4.1 million.
And Taraba State in the northeast has been ranked 5th in terms of COVID-19 vaccination coverage in the country with 96.6%. This was disclosed by the Executive Secretary, Primary Healthcare Development Agency, Mr. Aminu Hassan in Jalingo. According to him, the agency has so far vaccinated over 80,000 residents and will not relent when there is the availability of vaccines in Nigeria and Taraba State.
You are all aware that we have successfully vaccinated over 38,000 people in Taraba State with the first dose. Then the second dose, we have also successfully rolled out the second dose, and we have successfully vaccinated 28,758 people with the AstraZeneca vaccine, which gives us a percentage of 96.6%. And in Nigeria, Taraba State is 5th in terms of that coverage. Not only that, we are also able to carry around first dose for those that were unable to get the first dose of the AstraZeneca vaccine. And I want to believe we have also successfully vaccinated 6,110 people with that vaccine. That put Taraba State on a level that I can say either comfortable but not so comfortable, considering the fact that we are yet to vaccinate at least over 70% of our populace. But I want to believe it is just because of the scarcity of the vaccine. And Nigeria is making concerted effort through the Federal Ministry of Health and the National Primary Care Development Agency to deploy vaccine. After our meeting of all the executive secretaries of Nigeria with the ED, National Primary Care Development Agency, we are made to understand that the next batch of vaccine will arrive in Nigeria in the next 1 or 2 weeks and is going to be deployed across board.
Now, our next story has a twist, how the pandemic affected education in Jigawa State. Well, according to the chairman of the Jigawa Educational Development Forum, Mr. Musbao Basirika, the 9-month closure of schools in the state contributed to the mass failure in Unified Tertiary Matriculation Examination, UTME, in the state. Mr. Basirika says children were not fully prepared after the long stay at home as a result of the coronavirus pandemic. Our correspondent Sadiq Ilyasu tells us more.
The effect of COVID-19 has strained various sectors in Nigeria, including the education sector, where schools have struggled to cope with repeated closures and reopenings as a result of the global pandemic. The situation is no different in Jigawa State, where measures were put in place to curb the spread of the virus, including the closure of schools for 9 months. According to the State Educational Development Forum, this has affected the performance of students in recent UME examinations.
The pandemic of coronavirus or COVID-19 pandemic have affected several life endeavors of people, especially on educational sector. We realize there is mass failure in just concluded UTME examination, which been connected to the issue of lockdown and COVID-19 pandemic measures been advised and taken by some authorities and imposed by some authorities, which I think it play a very vital role in contribute, and also it contributes to the mass failure of the student pandemic.
Some parents believe that access to digital learning resources and online learning platforms to support teachers and students will help.
Jigawa State government should intensify efforts in seeing that teachers in the post-primary schools were giving intensive training on the usage of e-learning for the use of the students, more especially those that are in their final classes.
Moving forward, the state government says that it will ensure students get a good education.
We have trained our teachers to ensure that they give a better quality education. Now we have built also additional infrastructures to ensure that we have decongest the existing classroom, so as to ensure that the learning environment has been made conducive for the student.
Beyond the promises, concerned parents are advocating for more efforts to address learning losses, particularly for vulnerable communities. Sadiq Ilyasu, Channels Television News.
And did you know that more people died of COVID-19 in the first half of 2021 than all of 2020? According to statistics from both our World in Data and Johns Hopkins Coronavirus Resource Center, from zero case deaths late 2019, it shows that in December 31st, 2020, 1.88 million people had died of COVID-19. Now, as of July 27th, 2021, that number has risen to over 4.1 million, meaning that over 2.2 million lives have been lost in just 6 months. That means that the virus is fiercer than ever, and we must continue to take responsibility. Joining us to take a closer look at this is a public health physician, Dr. Olanlesi Osadiaye. Thank you for joining us on the program.
Thank you for having me.
All right. Looking at the rise in cases and deaths this year, countries are trying to balance their economies with public health measures, clearly, and then, as they open up. But are we really succeeding in curbing the spread with all of the measures we're putting in place?
Oh, well, the truth about it is that it's a virus, and definitely it's going to mutate, is what we're seeing currently right now. And because of the mutation, sometimes it looks like our public health measures are really not being effective, but the truth is that they are. So with the development of the vaccines and also with all the other public measures that we are putting in place, I believe if these things were not in place, we probably would have worse of numbers than we have right now. So yes, our public health measures are working, and we're trying our best with what we have on hand.
So very recently, a few states are reopening sort of their response strategies, mechanisms to sort of combat and prevent transmission with the Delta variant. What should be priority for states in Nigeria especially?
Okay, so for states in Nigeria especially, I think the first thing we should do is go back to the basics, which is emphasize our public health measures. Wear your mask, wash hands, social distancing. The kind of economy that we have, it's not an economy that we can say, oh, we want to lock down with something like that. We actually have to start with the basics that we see that a lot of people have dropped. In addition, we also have to improve testing because really in this half of the year, we've not really been testing so much. So we have to scale up our testing mechanisms, and definitely we have to vaccinate more people. I think with those three measures, we can actually try and fight the virus. I know the last two things we have to work on, so we can start at least with the first one. Let's just start re-emphasizing the public health measures that we have all seen to drop.
All right, Dr. Olanlesi, we always appreciate your time on the program. Do stay safe. Thank you for joining us.
Thank you very much for having me.
Well, still to come, we take a look at the virus trend in other countries. Please stay with us. Welcome back. In the midst of the COVID-19 pandemic, another rare virus was brought into the United States while a man was on international travel. Our Washington correspondent Maria Bird has the details.
While the U.S. is in the midst of a surge in COVID-19, another virus, monkeypox, has been introduced to the country. This virus was brought into the U.S. by a Dallas, Texas resident who traveled back to the U.S. from Nigeria. The U.S. responds to the monkeypox with caution, but assures Americans that the virus is a minimal risk to the public.
The nature of this, you can't transmit it until you develop symptoms. So the people who may have been in contact with him we'll monitor them. But they can continue on their, with their normal activities, monitoring for symptoms. Again, I think it's very low risk for the general public.
Medical experts do not perceive that monkeypox is a major health threat to the U.S., but it is on the list of potential viruses that could be problematic.
Because it causes a very severe disease in people, and the only reason why it hasn't been a problem to this point is that the virus has not ever really figured out efficient human-to-human transmission. Mm-hmm. So the old wisdom here is that it takes large respiratory droplets and a lot of contact time, and that's something that we originally thought for COVID, but may not be as true with some of the newer variants. So it's possible that there's some variation here, but right now it looks like something that would be blocked very well with masks. And from what I understand, there were masks in place on the flight. So that's one nice thing that came from COVID, if any.
While Americans are monitoring the one monkeypox case in the U.S., the number one concern continues to be the fight against the coronavirus. From Washington, Maria Bird, Channels Television News.
And indeed, our Washington correspondent Maria joins us right now. Thanks, Maria. Good to see you. So the patient in Dallas is stable and recovering?
Patient in Dallas is stable and they are recovering. It appears as if what they did was put them in isolation for some time and stabilize them. And so it is expected they will have full recovery and that this will just affect this one individual.
As regards his contacts, is there still a potential risk, even though we're told that since travelers are required to wear masks at airports, planes, the risks are quite low?
Yes, the risks are extremely low. And we do know that at this time that because, as you heard in the report, they don't see this as a virus that is very transmissible human to human. And so because the U.S. at this time is still in the midst of the pandemic and wearing masks are still critically important at this time, and they are required on airplanes in the United States, that they don't foresee that there was any type of potential risk for those on the flight and obviously for anyone else that's been in contact with this individual.
Let's talk about the mask guidance in the U.S. and perhaps not for monkeypox. For COVID-19, there seems to be a lot of different advice in different states. Talk us through what's going on, especially what the central government, and this is the Biden administration, are saying.
Yes, the Biden administration has been very clear that this is becoming a pandemic of the unvaccinated. And so they are cautioning, obviously, anyone that is unvaccinated to ensure that they are wearing a mask at all times. But of course, what is of utmost importance and what is the recommendation at this time is for all unvaccinated to be vaccinated. And so they are also stating that if you are vaccinated but in a group with those who are unvaccinated, it is still advisable to wear a mask if you are in a crowd of individuals that are not all vaccinated. But obviously, there has been for quite some time now regulations and recommendations that if you are in a group of vaccinated individuals that you don't need to wear a mask. And so I think that is the hope for where the government will be moving forward with recommendations. And obviously, hopefully that many states that have high numbers of unvaccinated individuals, hopefully they will begin to have more higher vaccination rates, which will then lead to the removal of masks on a much wider scale.
And perhaps one more recommendation that we're seeing is some states are expanding testing, yes, but there's also mandating vaccinations too. I mean, how are citizens reacting to that, especially, those who are hesitant to receiving the vaccination?
That's the greatest challenge. You have many that are, not wanting to adhere to the vaccination laws. And so obviously you're beginning to see many court cases, many civil rights and civil liberties being brought up, stating that it is my civil right to decide if I want to have a vaccine or not. And so you will probably begin to see this play out in court more and more as states begin to mandate vaccinations, and especially employers. That is becoming a huge concern concern right now is employers requiring vaccinations, and if they do require that, what does that mean for those unvaccinated individuals or those who are refusing to get vaccinated? Are they then going to be able to be unemployed? So this is going to become, I think, an even greater political issue as we move forward. But it really is going to be incumbent upon the federal government and the states government to really have one accord and alignment on what the policies will be so that the U.S. can move past this pandemic.
All right, thanks very much, Maria Liferis there from Washington.
Thank you for having me.
And despite government efforts, including extended curfew measures, citizens in Algeria have despaired over oxygen shortages and a vaccination program branded chaotic by the TSA news website. Prime Minister Amen Ben Abderrahmane inspected facilities at the Mazafran Hotel in the capital on Monday, several days after announcing that a large hotel in each province affected by the pandemic would be turned into COVID-19 facilities. Well, state broadcast the president's visit, reporting that the hotel will provide 712 beds in 446 rooms for patients requiring breathing assistance after receiving initial treatment in hospital. Well, here's more on the global update.
The EU is on course to hit a target of fully vaccinating at least 70% of the adult population by the end of summer, given that percentage of those 18 and over have now received a first dose.
The European Union has kept its word and has delivered. Our target was to protect 70% of adults in the European Union with at least one dose of vaccination in July. Today we have achieved this target, and 57% of adults already have the full protection of double vaccination. So these figures put Europe among the world leaders.
Over in the UK, British Prime Minister Boris Johnson says it's important that people did not draw premature conclusions about several days of better COVID-19 case data and urges the public to remain cautious.
I've noticed that obviously that we're 6 days into some better figures, but it is very, very important that we don't allow ourselves to run away with premature conclusions about this. The step 4 of the opening up only took place a few days ago. People have got to remain very cautious, and that remains the approach of the government.
Away from Europe, the Japanese Prime Minister Yoshida Suga says the record in COVID-19 cases hit by Tokyo is not a problem for the Olympic Games, but residents should focus on working from home to suppress the movement of people. Tokyo reported 2,848 COVID-19 infections over the past 24 hours, the highest since the pandemic began, as media reported that authorities had asked hospitals to prepare more beds for patients as the Delta variant drives the surge. And finally, over in Thailand, Bangkok plans to create 240 beds for coronavirus patients with mild symptoms by turning train carriages into isolation center. It comes as daily reported cases in the capital continue to generally trend upwards, according to government data, placing a strain on medical facilities.
Stay safe and continue to take responsibility. You can visit our website for more updates, also a better understanding of the pandemic. You can find breaking news there and more, of course, on other stories there. It's channelstv.com. It's at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.